When someone's torn their ACL, they usually know they've done some major damage. It's not one of those subtle injuries. It's usually someone felt a pop, heard a pop. Their knee oftentimes swells quite significantly. On the rare occasion, you have no swelling, but most of the times it does swell quite significantly. So when you do feel something's wrong in the knee after you've done some sort of an activity and you feel that you've done some major damage, you really do need to go and see an orthopedic surgeon and get that knee assessed. It's a pretty quick and painless way of diagnosing the injury with exam and then followed by an MRI. An anterior cruciate ligament injury is when the main stabilizer of the knee, the central tendon in the knee, ruptures or partially ruptures or gets stretched out is not performing properly, and you have an unstable knee, which you actually need when you're doing sports that require pivoting. So it's very common for athletes to tear their ACLs. This happens a lot in soccer, basketball, and football. It also happens with just a weekend warrior. And any kind of sport, it's possible. So one of the things that we do at a visit for someone who's complaining of knee pain or they felt a pop in their knee and their knee does not feel stable is we'll get some x-rays. Sometimes on x-ray you can see some signs of an ACL tear. It's rare, but sometimes you can see a little avulsion fracture that can tell you that there's probably an ACL tear. Most ACL tears, however, require an MRI to see just how much of the ACL is torn and also is there any additional injury in the knee. It's very common when you tear an ACL acutely to also have meniscus tearing. So we look closely at the meniscus because the meniscus is a very important structure in the knee. And if you can repair a meniscus tear at the same time as an ACL reconstruction, you can help prevent more arthritis in the future. So a lot of times when we see these patients, we'll examine the patient. If they have more laxity or looseness in the knee, we'll send them for an MRI. Once they come back from the MRI, we'll review the MRI with them. We'll give them their options when we're discussing surgery of the ACL or to reconstruct the ACL. And there are two main choices when you're talking about an ACL reconstruction. You're talking about what do you put in there? What is the graft material? Is it the patient's own tissue or do you use a cadaver graft? Those are the two main issues that we discuss. And some of the criteria we use on that is the age of the patient. There's a lot of data out there saying anyone under the age of 30 is probably good to use their own tissue. Anyone over 30, they have a choice of using cadaver graft or their own tissue. We have this discussion, we talk about the pros and cons of each, and let the patient kind of decide what they want to do. Does everyone who's torn an ACL need an ACL reconstruction? And the answer is no. I think when you're talking about people's activity level, what they want to do in life, not everyone has to have an ACL reconstruction. There are some people who have an ACL tear and can perform a lot of activities just fine and they don't feel like their knee is unstable. There are some people who tear an ACL, can't walk across the street and step up a curb without the knee giving out. So you kind of have to take everyone as an individual, what their goals are, what the knee actually feels like. If someone's on the fence about wanting to have an ACL reconstruction, I think the best idea is to rehabilitate the knee, do some therapy, give it 4 to 6 weeks, see if they're making progress. And if they're very happy, then sometimes they don't go on to an ACL reconstruction. Sometimes you can also get an ACL brace. When you want to do activities, you put a brace on, and that can lessen the risk of having another incident where the knee gives out or what we call pivot shift episode. So again, you don't have to have an ACL reconstruction in every case, but I do think in the younger active patients who have a lot of life left and a lot of things that they want to do in life, I think an ACL reconstruction is the most common choice. Most ACL reconstructions, depending upon what graft you use, an ACL done with your bar and cadaver graft is a faster procedure. Normally I can get those done in about 45 minutes. But if I'm using your own tissue, obviously it takes about another 30 minutes on top of that to harvest the graft, prepare the graft. So you're adding another 30 minutes when you're talking about using your own tissue. Once the ACL reconstruction is done, then comes the hard part, the rehab, probably the most important part. In the first few weeks to a couple months after the surgery, the idea is to regain your range of motion, quadriceps activation, but protect the graft. When you use your own tissue, obviously you're rubbing from Peter to Paul. There's more pain, there's a bigger scar, there's more stiffness. So really kind of getting therapy started very quickly on the autografts is important. Allograft is the same. It's still important to get started, but there's not nearly as much pain. It's a smaller incision. You haven't taken your own tissue, so the recovery feels a little bit less painful, and you kind of feel like you're making gains a little faster. However, an ACL autograft incorporates faster, whereas the allograft takes a little longer to incorporate because it's borrowed tissue. So it does take still about the same amount of time before you can get someone back into full sports. Normally it's about 9 months to get back to full sports. Some people have had 6 months in the past, but I think the data is really pushing us more towards 9 months to a year. And really some of the data even says it takes about 2 years to get back to your full form, full strength after an ACL reconstruction. This is Dr. John McGarry of Plano Orthopedics and Sports Medicine. I also live in the Dallas-Fort Worth area, and so if anyone around the Dallas-Fort Worth area is ever having issues with their knee, feel that they've torn their ACL, torn a meniscus, or any other structure in the knee, we are available 5 days a week in Plano, Texas, so just give us a call.